People who work on the front lines of mental health care say the challenges they're seeing are evolving. Today, some of them here locally sitting down with Senator Tammy Baldwin. Talk about what they say needs the most attention. Elise Noe has more on those challenges.
Local mental health leaders say they're facing a growing list of challenges, from rising demand for care to funding concerns and changes to the 988 crisis system. Those issues took center stage during a roundtable in Green Bay where organizations highlighted the region's growing mental health needs.
We're all working really hard and working together and intersecting in the community needs.
The discussion comes as a recent study published in JAMA Network Open found the launch of the 988 Suicide and Crisis Lifeline was associated with an estimated 11% reduction in youth suicide deaths compared to projections. At the same time, the call center is seeing more young people reach out during the summer, which they attribute in part to school being out. Another issue raised during the roundtable was the loss of the 988 Lifeline's specialized Press 3 option for LGBTQ+ youth.
And we did see an increase when we lost that Press 3 option. So the more educated we are in serving that population, and honestly, just the non-judgmental, we serve everybody that way.
But the bigger challenge extends beyond any one program. Mental health leaders say they can only do so much without enough resources.
And if we take away those resources, where does that leave the help seekers? It leaves them even more isolated. So I would suggest that mental health resources are important. Yes, 988 is available 24/7, and I'm honored to be a part of their journey. But we need consistency across the board.
In Green Bay, Elise Noe, Action 2 News.